This is Jose Merino, Editor-in-Chief of the Neurology family of journals. The Neurology podcast provides practical information to neurologists and other clinicians to help them provide better care for their patients. Thanks for listening and have a great week.
Hi, it's Jeff Ratliff with Thomas Jefferson University and the Neurology Podcast. I'm here with Rachel Gottlieb-Smith from the University of Michigan and Kathryn Xixis from the University of Virginia. Rachel and Kathryn are two authors from a recent Viewpoints article that was published in Neurology Education back in September of this year, titled Artificial Intelligence in Residency Recruitment, Impact on Equity. Listeners to the podcast don't need to look far to find examples where we've gotten into topics surrounding the explosion of artificial intelligence technology and how it's really coming to change our lives across different areas of neurology. Even back in January of 2023, just a few months after the release of ChatGPT, Stacey Clardy spoke with Stephen Marsh from The Atlantic about what the future of neurology and science and writing may be looking like following the release of natural language processing technology. In subsequent episodes, we've talked about artificial intelligence use in the interpretation of EEG. And this past summer, Andy Sutherland interviewed Lydia Mora about the use of large language models to improve efficiency and quality in neurology care. So in that vein, we invited Rachel and Kathryn to the podcast, and we're going to turn the lens now towards neurology education and residency recruitment and talking about training and recruiting learners in neurology. And in this paper, Rachel, Kathryn, and their co-authors really guide us to consider both benefits as well as some of the pitfalls and dangers of implementing AI and machine learning into the process of recruiting for neurology residency. So without further ado, Kathryn, Rachel, welcome to the podcast.
Thanks for having us.
So Kathryn, I want to start this first question for you. And this paper really points us towards kind of a double-edged sword of using artificial intelligence, especially when it comes to evaluating residency applications. And perhaps before we jump into the implementation of AI, for our listeners who aren't part of the residency program recruitment process, can you tell us about the recent landscape of residency application review and how it may prompt program directors to be looking towards AI to help them?
Absolutely. So what we've seen over the past several years is actually an increasing number of applicants to neurology, both child and adult neurology. And that really has continued to expand since we adopted the virtual recruitment format several years ago. Let's talk a little bit about the data over the last 5 years. Most recently, it was released by the AAMC for this current recruitment season. And what we're seeing in terms of trends, in adult neurology, there are 135 more applicants this year than in the past. But looking back to 2019-2020, which was our last season where we did in-person recruitment, that's actually 572 more applicants to adult neurology. So you can see the increase in kind of the trends over time. This year, adult neurology programs are receiving 660 average applications per program, which is, again, a significant increase over the past 5 years. When we look at the child neurology data, we see very similar trends and patterns. This year, we are having 48 more applicants to child neurology than in the past. And for those who don't think about the child neurology numbers as much, that actually is a significant increase because this year we have 389 total applicants to child neurology residency. So 48 is a significant percentage of those. And as with adult neurology, we see the same trends. So 81 more than in the 2019-2020, so our last in-person interview season, with upward trends over that time as well. And this year, child neurology programs are receiving 120 average applications per program, also an increase since our 2019-2020 in-person season. So with these trends and this backdrop, there's also an increasing desire for more holistic review. And this is where we find ourselves with decreasing reliance on test scores, not only because we want to more holistically evaluate applicants, but also because of that recent transition of step 1 to pass-fail. It's just a lot harder for us to really use that as a particular screening or evaluation item. We've also seen decreasing ability for us to use scores and grades from medical school because we know clerkships and pre-clerkships have really moved and pushed or are in the process of moving toward more pass-fail type evaluations. Same thing is true for class rank. And so when we look at that all together, we really need a way to holistically evaluate people. And so the question becomes then, how do we evaluate an increasing volume of applications still in a holistic manner? And really, can we harness AI to do that? Can AI help us make that more equitable and a more complete process?
Rachel, given some of that backdrop and the impetus to try to leverage AI technology to deal with these problems, when we're looking at things like natural language processing or machine learning or other subtypes of artificial intelligence, how are they different? What are the pros and cons that these different subtypes of AI are bringing to this context of residency application review?
In general, for application review, I think of predictive AI mostly, and that's the type of AI that can analyze patterns, it can predict future outcomes, and that's in contrast to generative AI, which is the type of AI that creates new content. And then within predictive AI, there are many subtypes, and they seem to be very overlapping. The two that I think of mostly with application review are machine learning and then natural language processing. So for machine learning specifically, that's the branch that looks to see patterns in large data sets, at times allowing machines to then self-learn and adapt over time. And there are different algorithms that machine learning can use. For example, there are regression algorithms that can predict outcomes. There are classification algorithms, and those can see patterns and group data. And that can be used in combination with natural language processing, which is the type of AI that seeks to understand and also process human language specifically. So for application review AI, we can integrate both, and that can allow machines to process and analyze unstructured text and in applications that can be personal statements or letters of recommendation, for example.
Okay, so we know there's a lot of data. A lot of it is language and narrative data that we're trying to go through both per application, multiply that over an increased number of applications. And then Rachel, you outlined how these predictive AI models and some of the machine learning processes or large language models can help us sort through some of that. So what can AI do for us to help human residency program directors sort of sort through a very quickly growing and complex process?
There's this increasing need for holistic review, this increasing number of applications. But we know that time is limited for initial review. Everyone in residency education is very busy, and there's really a fairly short window, right, between the beginning of when you receive applications and need to review them and then send out those invitations for interview. That's really not a very long time. For that reason, human review has often utilized simplistic cutoffs for this initial review. People in residency education, I think we want to do a more holistic job on reviews, but it just isn't always possible depending on how many applications your program has received and the turnaround time in which you need to look through those. So this is where AI comes in. When we train an AI model to assess for the characteristics that our residency program really desires, AI can help us more quickly complete those holistic evaluations. And it's interesting because you might think, well, if I let a machine pick my applicants, I'm going to miss people that I would have wanted. But it's actually been looked at, and we see increased efficiency in the review process actually leads to inclusion of applicants that might have been excluded by a human screening process. In our paper, we discussed an example of this where machine learning-based decision support tool was used for application review in the 2020-2021 application cycle. And that was published by Burke, Raphael, and team. And it's interesting because the additional applicants were actually selected for interview by that decision support tool who were actually excluded by the initial human review that was done prior to them utilizing the AI tool. And this is really often because of a large number of applications or over-reliance on a single application factor. And this is where AI can be really helpful.
And so I am a residency program director. What is stopping me from just full steam ahead signing up for this? And I alluded to at the beginning, this is a double-edged sword.
What we focus on in the paper is concerned for the inadvertent addition of bias. Even though we're hoping to improve equity, we may actually be adding bias with AI. So for example, if our algorithms are biased, we'll end up with biased output, garbage in, garbage out. So it's really important that we carefully develop and then reassess our algorithms over time and make sure that they're up to date and fair and reflective of our program's vision and mission. There's also potential for historical bias if AI is trained on a historical data set. For example, a set of past applications or CVs from prior successful residents. And in the viewpoint, we talk about a cautionary tale from Amazon. Amazon developed this AI-based resume review program in the mid-2010s that was trained on a historical data set of resumes that had been submitted to Amazon over the prior 10 years, most of which came from men, since there was greater male representation in the industry at that time. And so the system actually learned to prefer men as candidates and developed an anti-woman bias. Of course, Amazon has since scrapped that system. They never put it into use, but we have to be cautious. Even though AI has developed a lot since the mid-2010s, right? We're in the mid-2020s. We have to be cautious about historical bias. And it's particularly concerning in a field like neurology, where significant historical biases exist.
Okay, Rachel. So the process has benefits, but as with many applications, it sounds like we absolutely need to be mindful of the criteria we're putting in and reevaluate the outputs that we're getting. And there are some examples, like you said, for those who are still very excited about this and hoping to leverage AI technology to streamline this residency recruitment process. What specific advice would you give to neurology programs or program directors that are considering implementing and adopting these tools? What are the most important factors to consider here?
I think we need just to be aware of the biases that AI potentially can bring. And it's really important that we look at our rubrics and we make sure, as we were saying, that they're up to date, that they're equitable, that they reflect what we want them to reflect, that we think about these with our program and make sure they reflect the program's mission. And we have to use AI experts in helping us design these models. And not just in the design, but also in the continuous model evaluation and training. So this isn't something that we can just set it and forget it. And we should be using human checks for a subset of applications going forward to make sure that we're not inadvertently introducing extra bias that we weren't aware of, and to make sure the process is equitable. And then additionally, AI may also make more explicit some otherwise hidden biases. So in the viewpoint, we talk about gender biases that exist in letters of recommendation. And we know this, and AI can help point that out so that human reviewers can then take that into account when they review applications. Of course, like we talked about, we have to be careful about other biases like the historical bias in neurology, and we don't want AI models to propagate those historical biases. But there's a lot of potential to improve diversity as well.
It sounds like if people are listening and really want to take home a point, we can't be passive in this implementation process and to be very deliberate and thoughtful about how we're going to use this tool. I think we all know that artificial intelligence is coming, whether we like it or not, and how we're going to use it may be sort of what varies between us. And so it's still relatively new, though, and things are happening very fast. And so what are the gaps in our knowledge that potentially research or education research could help fill going forward? What is it that we can still study and learn about the role of AI in resident selection or resident recruitment?
There's absolutely a lot of stuff for us to still study and learn and think about. As we start to actually implement these models, we've talked a lot here about things we're concerned about or things we think will be helpful, but it's important for us to better understand and actually study what happens when we put these models into play in terms of equity, in terms of mitigating or increasing potential bias. It's also really important for us as a neurology community to think about establishing and developing specific tools that can be used for neurology recruitment, to study those systematically, and hopefully that can be something that helps our entire education community as we think about residency recruitment. As Rachel talked about, it is incredibly important for us to continuously look and evaluate our models and reassess how they're doing. The importance of human checks cannot be overstated on the AI models as we move forward, as things change over time, and we want to make sure that our AI model is reflective of what we think it is and what we hope it is. We are very excited about these tools, and we think they have a lot of potential in residency recruitment.
The lessons learned here really do have an application in lots of different areas, both in education, as we mentioned, in the clinic and in research and everything that we do. I've been speaking with Kathryn Xixis and Rachel Gottlieb-Smith about their paper in neurology education titled Artificial Intelligence and Residency Recruitment Impact on Equity. Kathryn and Rachel, thanks for joining us.
It was a pleasure.
If you've enjoyed the podcast, please take a few moments to subscribe, rate, and review the Neurology Podcast through Apple Podcasts, Google Podcasts, Spotify, or wherever you listen. And remember, you can always head to neurology.org/podcast for our full list of past episodes, or you can also search by keyword in your podcast app for any neurology-specific topics you want to learn about.